Hello, my name is Brittney Mackins and I'm a student nurse at Cedar Crest College, and here I am to present my 322 research on the effects of motivational intervention on blackouts among college freshman students. So the research purpose, the study proposed to examine motivational interviewing as an intervention that impacts the rate of blackouts and high illicit drug use and alcohol consumption among college freshmen. It was found that college students during their first 6 to 8 weeks of school are at high risk for drinking and drug use, and usually it can be due to the transition from being in high school, being at home under parental guidance, and going off to college and becoming a freshman and being exposed to new environments. The research problem. It was to examine the alcohol consumption and illicit drug use among college freshmen to determine if motivational interviewing intervention will help decrease the rate of alcohol consumption and illicit drug use, thus reducing the effects of blackouts in its occurrences. The research question. Is there a reduction in blackouts when comparing alcohol consumption and drug use from the baseline to 6 months? And also, is there an association between prevalence of blackouts due to consumption of alcohol and illicit drug use based on race and gender? The significance to nursing practice. Nurses will encounter and identify students that experience blackouts from alcohol consumption and illicit drug use in the healthcare setting themselves. Also, nurses can refer students to MI intervention when conducting history screenings and for drug and alcohol abuse. The study design. It was a longitudinal study design. The sample consisted of 188 students from a large public university in an unknown southern state. The study's framework was an MI harm reduction alcohol skills training approach. Only one group of students were examined throughout this entire study at the university. 3 types of questionnaires were used: the daily drinking questionnaire, Rutgers Alcohol Problem Index, and Government Performance and Results Act. The intervention was an MI, which is also called the motivational interviewing, and it was performed 4 different times throughout the study. The intervention. It was motivational interviewing, as it was one of the most effective intervention strategies for high-risk drinking behaviors. It is patient-centered, non-confrontational, empathetic, supportive, non-judgmental, directive, and solidifies students' self-efficacy for commitment to changing their behavior. Participants received MI at baseline, 2 weeks, 3 months, and 6 months of the study. The assessments were performed at the baseline and at 6 months for comparison purposes. Participants, they met individually with trained peer interventionalists who instructed the MI program themselves. Research variables. There were 2 different types, as in for the independent and the dependent. The independent variable was the MI intervention, as it decreased and or stops reoccurrences of blackouts within students from illicit drug use and alcohol intoxication. And the dependent variable, I found 3 different ones. They were the amount of alcohol consumption and drug use by the students, the frequency of the alcohol and drug use, and about how many blackouts the students were experiencing themselves. The criteria for eligibility. So those included the inclusion and the exclusion. The inclusion were that they had to be a full-time college freshman student that attended the large public university that the researchers were studying from. They had to be between the ages of 18 and 20 years old, drank alcohol within the past 30 days. They had to be able to read and write English, and they had to have a willingness to participate in the study, as in attending the 4 MI intervention sessions. The exclusion criteria, one of them were not meeting the inclusion criteria that I just listed, and that's also listed on this slide, and not attending all 4 MI intervention programs for the program sessions. The ethical components. Institutional review board approval was granted prior to conducting the study, and participants signed and completed a consent form prior to completing the baseline of the questionnaires. The strengths and weaknesses of the study samples. So some strengths were that it was a defined study sample, which made it easier for researchers to gather the comparisons and relate them to one another, because it wasn't as many students as they originally believed they were going to be participating. It was a longitudinal study design, and it lacked attrition of participants between the baseline and at 6 months. The weaknesses: it was a lack of a control group and social desirability. It made it a little bit difficult for researchers to determine if the truthfulness of participants reporting blackout occurrences were actually there, due to participants were just volunteering to engage in the study, and you're honestly just going by participants' willingness to participate in the study properly. You had to just go by their word and not do any type of medical assessments for it. The data collection. Participants, they were recruited from a classroom seminar and residence hall on campus. Interested participants were actually telephone screened prior to conducting the study. They then received a consent form that they had to sign before beginning the study, and once engaging in it, they had to meet individually with the trained peer interventionalists who delivered the MI programs to them, and that incorporated educational and personalized feedback in a one-on-one session with the interventionalists. The MI program was given in 2 50-minute therapy sessions, one at the baseline and then another one at 2-week session, 3 months, and then the 6 months. And then you had to make the comparisons at the baseline and at 6 months. Students completed their questionnaires to assess their alcohol use and the negative consequences at baseline and at 6 months to compare the results. And the data was collected and reviewed at the conclusion of the MI program itself. The data collection tools, as I said, there were 3 questionnaires that were used. The daily drinking questionnaire that measured the quantity and the frequency of drinking patterns within the students. Then you have the Rutgers Alcohol Problem Index, and that measures the impact of alcohol consumption on social and health indicators. Then you have the Government Performance and Results Act that collected demographic information of physical and health problems, social connectiveness, unprotected sexual history, and or drug and alcohol use. The data analysis had the logistic regression model and investigated the association of alcohol, drug use, and gender to blackouts for the first time at 6 months, and the generalized estimating equations that associated the blackouts and drug use and alcohol consumptions and determined the marginal models and patient-specific modules of that. The findings: a significant decrease in the weekly number of drinks, weekly number of hours drinking, and the drinking days. Frequency of drinks decreased from 27.1% at baseline to 23.4% at 6 months. Blackouts decreased from 6 months for 72% of participants who reported to having them at baseline. 9 out of the 112 students reported to having blackouts at 6 months, even if they didn't have it at baseline. And despite the frequency of blackouts, it was gender related because males that drank more did not have more blackouts than the females. The study limitations: it was a small sample size, causing restricted generalized findings, self-selection sample and social desirability due to lack of control group and randomization, and labor intensity and need for ongoing assessments for the interventionalists. The MI intervention did provide positive outcome by deterring high-risk behaviors that had a negative impact, and the study was used as a formal MI intervention program at different universities with different researchers. It helped guide future college students. And that is my presentation.